study.
Uh, Good afternoon, everyone. As we are aware that now this month has been celebrated, is being celebrated as a cervical cancer awareness month. So we will be having some important discussion about the cervical cancer and how it is important to discuss the cervical cancer on this particular forum will be, as we are aware that it is one of the most commonly diagnosed cancer in India. So earlier it used to be number one cancer in Indian female population, but nowadays because of the certain practices, it has become a second most cancer apart from the breast cancer. So it is very commonly diagnosed cancer, and second thing would be it is obviously curable if it is diagnosed in early stages. So earlier the diagnosis that will help us to improve the survival outcome for the cervix cancer. So in the next few slides we will be going through some of the common aspects related to cervical cancer, as we know that it is second mostly common diagnosed cancer among the Indian female population. One in the five cases of cervical cancer worldwide are from India, and it is a leading cause of death in females. Although it is easiest cancer in females to prevent though through the screening as well as vaccination. So important thing would be early either early diagnosis, or major thing would be we can prevent it by doing the regular screening as well as through the available vaccines also. So this is a normal anatomy of the female genital tract, and we can see there is a cervix portion which is situated in between the body of the uterus and the vagina. So that is a part where the malignancy arises, and we label it as a cervical cancer. So there would be other malignancy like the ovarian cancer, uterine cancer, and but the cervix cancer is the most commonly diagnosed cancer in the Indian subset, basically. So these are what are the common symptoms, how we will be able to know about the patient whether she's having the cervical cancer or not. Sometimes the patient may be asymptomatic when the tumor is very small, and it may be incidentally discovered through the screening basically, or sometimes the tumor may be detected when the patient has been subjected for some certain pelvic examinations or the similar test. But in our settings, majority of the women they will present with the either the abnormal or the heavy vaginal bleeding. That will be the common symptom. Apart from that, they may present with bleeding specifically after the sexual activities. Sometimes they may also present with some kind of abnormal vaginal discharge, like it may be some watery discharge, sometimes some foul smelling discharge. Although it is a very non-specific, but still many of the times we see these kind of presentation. Apart from that, some patient may present with the lower abdominal pain or the pelvic pain. Sometimes if the disease is advanced, patient can present some symptoms related to either the urinary or the bowel related symptom due to the basically due to the pressure symptoms. Sometimes in very advanced stages, patient may have some of the common symptoms like maybe the weight loss, weakness, maybe due to the blood loss and development of the low hemoglobin. So in these cases, what is important is that whenever there are any kind of vaginal discharge, it is basically, it may not be every time related to the carcinoma of the cervix itself. There might be some other causes, like it may be a physiological, or maybe in some cases it may be due to some other diseases itself. So what are the risk factors? So what factors are there that will drive the development of the cervical cancer? Basically, as we know that cervical cancer is most of the cases it is related to this important infection called as a human papilloma virus infection. So basically almost in 99% of the cases, these cancer are related to this HPV infection. HPV means that is a virus, human papilloma virus. So and this when this HPV infection is related to development of the cancer, the risk factor are like early resumption, early onset of the sexual activities. So before age of 21 versus age of 21, almost there is double or three times increase in the risk of development of the cervical cancer if their onset of the sexual activities before the age of 21 years. Another important factor will be the multiple sexual partners or having a high risk sexual partner, those who are having some kind of sexually transmitted diseases, and those will be the high risk candidate who are likely to transfer the more chance of the spread of the HPV infection. Apart from that, those partners who are having history of sexually transmitted diseases basically, and then there will be some other factor like early age of the first birth, or maybe the increase having multiple deliveries or having multiple babies, because ultimately that will increase the risk of the HPV infection. Apart from that, the immunosuppressed condition like HIV will be one of the risk factor for development of cervical cancer. So basically a majority of the cases cervical cancer is related to the HPV infection, but there are certain other non-HPV related causes also, like low socioeconomic status where the cervical cancer is commonly seen. Basically the cause that has been described is in this particular subset of the patient, like low socioeconomic status would be less awareness, maybe the less access to the healthcare facilities. Apart from that, smoking increases the risk of cervical cancer, and prolonged use of OC pills, that is oral contraceptive pills, will ultimately increase the risk of the cervical cancer. Apart from that, it has been said that cervical cancer is less common in patients whose sexual partners are have circumscribed male. So apart from this, so when we talk about the cervical cancer, the basic focus will be on HPV infection itself, that is human papilloma virus infection, which is mainly spread by the sexual activities. Sometimes even many of the times this infection can be asymptomatic, and there are different kind of HPV related, whether it would be a low risk or the high risk kind of infections, and this high risk kind of infection that ultimately causes the cell damage and leading to the development of the cancer. So normally what cancer is? Cancer is a abnormal growth or with the cells of the body where the normal defense system is been encountered. So apart from this, so when we talk about the HPV infection and cervical cancer, majority of the female will have this infection by the age of 30 years, and although the infection is quite common, but majority of the cases it will be cleared by itself also. But only in some cases this infection persists for longer period, and that will lead to some of the precancerous development that will be ultimately led to the cancer over the period of 10 to 15 years if this infection persists and if there is a development of the precancerous lesion. So although there are different kind of HPV strains are there, but majority 13 types of the strains they causes the cancer. Among that also HPV 16 and 18, which are the most prevalent, and these are responsible for almost 70% of the cervical cancers. So this HPV infection is, as we know, that it is a major cause for the cervix cancer, and 70% are caused by these main two subtypes, that is HPV 16 and 18. So as we know, this is the how the cervical cancer develops. So whether once there is an infection with the HPV, either it may resolve by its own or by the treatment, or it may persist for a prolonged period. Once it persists for a prolonged period, there will be development of certain precancerous lesions which ultimately lead to the development of the cervical cancer. So who is at higher risk of this HPV infection? Basically individual who is having multiple sexual partners, as well those sexual partners who are exposed to the multiple partner. So ultimately it is the risk of HPV that is being spread across the multiple sexual partners. So we should try to limit the number of the sexual partners to the great extent as far as possible. So, are there any methods to lower the risk of getting the cervical cancer? Yes, definitely. As we have already seen, it can be basically prevented by doing the regular screening with the pap smear, doing the regular checkups, and as well as regular follow-up. The another important aspect was limiting the sexual partners to reduce the risk of HPV infection. And similarly, avoiding the smoking would be very important factor, as well as adopting some of the healthy diet and the lifestyle factor, just to reduce the risk of HPV infection and associated sexually transmitted diseases. It is advisable to use the some of the contraceptive measure like using the condoms consistently and correctly during the sexual activities. So what is the purpose of the screening? Because we know that asymptomatic means screening would be these are the tests who are carried on asymptomatic individual. Normally, when we do any kind of test, these are on the symptomatic individual, but the screening is done in the asymptomatic individual just to detect, just to find it out whether there would be any precancerous lesion or maybe the early stage of the cancer itself. As we know that there are certain screening methods, but these are very appropriate in cases of the cervical and the breast cancers. So when we talk about the cervical cancer screening, why it is important? Because it is very important so as to diagnose at an early stages. Maybe we can prevent it through when we be able to diagnose some of the high risk lesions at an initial stages, so that we can take an appropriate steps. So there are two different kind of cervical cancer screening method that are being adopted. One is called as a pap smear, and second would be the HPV DNA testing. So these are the screening methods. How, what are the guidelines? So normally the screening would be advisable to begin it at age of 21 years, except some of the individual like those who are HIV positive, maybe immunocompromised patients, or young patient who has been previously treated for either cancerous or the precancerous lesion. Similarly, it has been advised to stop the screening at the age of 65 years only in those who has the previous normal screening and there are no high risk factors. Similarly, the screening guidelines are same for the HPV vaccinated individual also. So why it is important to screen even when the HPV vaccination has been done? Because the HPV vaccination does not protect against the wide all varieties of the virus that are there. So the vaccine would protect against the certain strains, but it is not that these only strains are responsible for the development of the cervical cancer. So it is not imperative to say that once you are HPV vaccinated there is no need of the screen, because we don't have a vaccine which will cover all the varieties of the HPV strains that are likely to cause the cervical cancer. So although the guideline means, although there are newer and newer vaccines are coming up, and number of the means the vaccine which are likely to cover the wide variety of the strains of the HPV, they are being developed. So this is the screening, how we can screening with the pap smear once in 3 years. We have to do the HPV testing with the pap smear once in 5 years, and but this HPV testing is not advised before the age of 30 years. So between age of 21 to 30 years, we have to just do the pap smear once in 3 years, but after 30 years and onwards, we have to do HPV testing as well as the pap smear once in 5 years. So these are the different some guidelines with the HIV positive patients, where we have to screen every 6 monthly for first year after the diagnosis, and then once in a year subsequently. Sometimes we have to do the special test called as colposcopy when there is abnormal pap smear also. So when to stop the screening? At the age of 65 years, provided that 3 consecutive pap smears are negative or 2 consecutive negative pap smear as well as HPV co-testing within 10 years, and most recent test has been done within the last 5 years. While there are certain kind of precancerous lesions, in that cases we have to continue for 20 years after the normal report or the test. So why do someone need to keep getting this test repeatedly? Because We know that this is not an one-time test, and there are certain abnormalities that are going to develop over the time period, even it has not been detected earlier. So it could take many years for the changes to develop, as we have seen that time period between the HPV infection and development of the cancer may be almost 10 to 15 years. That's why we have to keep doing these tests at a regular interval so as to detect the changes happening over the time period. And also the risk would be changing once with the new partners also, or if the partner will change their partners. So this is a figure which shows how this pap smear is being done. This is a speculum which is used for doing a pap smear, and this is a particular kit through which we usually take a pap smear. So what will be the results once we will do the pap smear? So either it will turn out to be a normal, it may turn out to a abnormal, like maybe there might be some minor changes, or there might be some severe changes that has to be encountered, or that has to be treated as per the severity, and ultimately it may turn out to be a malignant or a cancerous result also. So how common these are, the abnormal pap test result? So these are also quite common. Sometimes even 80 to 90% of the low grade abnormalities regresses on their own. Suppose these are very at early stages, mild kind of changes, they can regress on their own, but if followed up and treated early, we can definitely prevent turning from this high risk or maybe the precancerous lesion to the cancerous one. So suppose even if the HPV test is positive, so whether it indicates that patient is going to develop a cancer? No. As we have seen that, so even the HPV test, once it turns positive, every time it may not be possible that it may turn up into the cancer. Either it may regress by its own, sometimes by the treatment, and even it may not be necessarily getting converted into the cancer itself. So although majority of the people are getting affected with the HPV, it may not be possible to develop every individual with the cervical cancer. Most of the cases it will go by its own, or maybe with the treatment, or sometimes it may not go by after for many years, and when it persists it will lead to the cervical cancer if possible. So there is sometimes patient do ask if it is a need of doing a pap test when the patient has undergone hysterectomy, that is removal of the uterus. So what we suggest is that if one individual has undergone a treatment for either a precancerous or a cancerous lesion of the cervix, we need to take it doing the pap test. And even suppose the patient has undergone removal of uterus only and the cervix has been left behind, in that case we have to do the pap test also. So how we normally treat this abnormal pap test? So we have to treat the infection, and again we have to treat this high risk HPV test. And suppose these abnormal tests, sometimes we have to be followed it with certain other tests called as colposcopy, and maybe certain other tests, other procedure called as laser ablation or the cryosurgery or maybe the cone biopsy. So this would be the colposcopy test. Certain cases when there are abnormal results, we have to examine the surface of the cervix using a colposcope, although the problem with this is the limited availability of this particular instrument. So normally what is the reason, although these are the very simple tests called as pap smear, HPV testing and all, but still why anyone would think over why the cervical cancer is so common in India? Because we have to consider the rates of the screening are very low in India, basically maybe because of lack of awareness, fear of examination, fear of pain, maybe the non-availability of the test, and because of the maybe the increased patient load in the hospitals, and because another reason would be we have to do it at very regular intervals. So again patient or normal individuals, they may feel that because of the multiple visits they may avoid doing the test. Because of all these reasons, ultimately the percentage of the regular screening with the pap smear and the HPV is low. But nowadays with the awareness, these number of the screening tests are becoming increasingly common and common. So, sometimes it may happen that every place the pap smear may not be available, pap testing may not be available. So, in that cases, there are certain other tests like we have to inspect the and they were to apply and this acetic acid for the testing to be done, and sometimes we can visually inspect it after the application of this particular solution called as lugal iodine also. So when we talk about the HPV, what is the burden? So not only it is responsible for the cervical cancer, but this HPV infection is responsible for other cancers, say like vulvar cancers, anal cancers, oropharyngeal cancers, as well as some genital warts. Also, like the penile cancers, oropharyngeal cancers, and the warts in the males are being developed because of the HPV infection. So as we know that HPV is responsible not only for major cervical cancer burden, but it is also responsible for some of the other common cancer. So nowadays these HPV vaccines has been developed, and so these were first introduced. This would be very important to discuss because we know that HPV vaccines are quite effective when we talk about this cervical cancers incidence and the development. So it was first introduced in 2006, and as we know that majority of the cervical cancers are caused by HPV 16 and 18. These cervical vaccines are intended to target these particular two strains basically, which are responsible for majority of the cases. And as we know that there are different vaccines, but they do not cover all types of the HPV strains which are responsible for cervical cancer development. So they will give a stronger and prolonged protection than the natural infection. And currently there are two kind of vaccines which are available in India for against this HPV infection. These are called as Cervix Vaccine, which is available only against the 16 and 18. But as we know that these cervical cancer can be caused by other variant, so newer other vaccine has been developed like Gardasil, which will cover 16 and 18 as well as 6 as well as 11, which are responsible for the other genital warts. But nowadays now this 9-valent vaccine has been introduced, Gardasil 9-valent vaccine. And as we know that as we are covering the different kind of strengths of the HPV, so these will bring the incidence, this will help us to cover the wide variety of the HPV strains, and ultimately that vaccine is going to become the more and more effective to bring down the incidence of the cervical cancer. So when we talk about the scheduling 3, and normally there are 3 injections which are given intramuscular like tetanus over the 6 months. Most this vaccine, one important aspect of this vaccine is that these are most effective when these are given before the resumption of the sexual activities, when the person becomes before the person becomes sexual active, because we know that the HPV vaccine is spread, means it person is becoming exposed to the HPV vaccine with the sexual activities itself. So what the main intention of that vaccine is, you have to vaccinate the individual before they become sexually active. Normally, suppose we can give only 2 doses if it is vaccinated before the age of 15 years, from 9 to 15 years. But if it is beyond 15 years, then it would require 3 doses of this particular vaccine. So normally 2 doses that has been given minimum interval of 6 months, but if we are trying to give 3 doses, then it will be 0, 1 and 6 months. So what will be important is that we have to consider this HPV vaccination before the sexual activity started. The efficacy of the vaccine varies accordingly. So the protection from this virus with this vaccine will be almost 97 to 100% when the when the individual has not been exposed to the HPV vaccine. But suppose the individual is exposed to the HPV vaccine, HPV infection, then the efficacy or the protection level of the vaccine is reduced to say almost around 40 to 45%, and this protection usually lasts for 8 to 9 years. And how safe are these vaccines? These are definitely FDA approved. There are no serious side effects. sometimes even the local site pain that can be experienced. And now this vaccine has been included in the national immunization program across the various countries also. And when we talk about what are the different treatment modalities for this cervical cancer, if it is a very early stage cervical cancer, we subject the patient for a surgery. But if it is say beyond some early stages like stage 1 and beyond, later stages of the stage 1, or maybe beyond like stage 2 and 3 and even stage 4A, in certain cases we treat these patients with the radiation treatment along with the chemotherapy. So majority, as we know that majority of the patient will be somewhere diagnosed between stage 2, stage 3 or later stage of the stage 1. So most important treatment modality will be the radiation along with the chemotherapy. But if it is in very early stages, we can treat the patient with the surgery itself. And I would like to highlight importance of the cervical cancer is that, so the treatment in most of the cases, say surgery or maybe the chemotherapy and radiation therapy, even this treatment will be over within 2 months period. I think this would be one of the rarest cancer when the patient is getting cured within only 2 months of the treatment and entire treatment is over. Not normally what we say in cancer, what we observe, it is getting treated over the prolonged time period, but with this, in this malignancy, the treatment is very limited, say only 2 months if we go ahead with even with the concurrent chemo and radiation treatment. So just I would like to bring some of the take home message that regular screening and the vaccination can prevent the development of the most common and the dreadful cervical cancer. So we can definitely protect the high risk or maybe the normal population also, and we have to seek the medical attention whenever we are having some of the abnormal symptom like say abnormal vaginal bleeding, vaginal discharge, postcoital or the postcoital bleeding, or some of the other related symptoms what we have already discussed. So it is definitely curable if it is diagnosed at an early stages. So thank you. So I would like to take some of the questions. Hello, can I answer the question now? So is cervical cancer curable? One of the question from Mrs. Kokila Shaha is the cervical cancer curable? Definitely it is curable, as we have discussed. Even from the stage 1 to early, even from stage 1, 2, 3 and even certain limited cases of stage 4A are definitely curable, unless until the disease is metastatic, means when it has spread outside the cervix, it won't be like maybe it is in the lungs or the maybe in the liver, and in that cases it won't be curable. But definitely there's a majority of the cervical cancer cases are curable. Second question would be Mr. Jubair Shaha, who asked, in stage 1 of the cervical cancer only chemotherapy is treatment option or any other treatment can work? See, in the stage 1 cervical cancer, normally it would be a surgical treatment that will be preferable, but some certain if we go from the delayed or later stages of stage 1, in that cases we would use the radiation treatment as a most important treatment modality. Along with that, we would need a chemotherapy along with radiation treatment to increase the effectiveness of the radiation treatment. So in stage 1, certain patient will be treated with the surgery to cure it off, or maybe certain patient may be treated with the radiation and the chemotherapy treatment. But definitely anyways, either ways, this stage 1 cervical cancer is curable, and hardly the treatments will be from 1 to 2 months only. So next question from Mrs. Deepika Hegde, the question is, can chemotherapy give result in cervical cancer treatment? See, the chemotherapy is never a main treatment for a cervical cancer basically. So most important treatment parts would be either a surgery or a radiation treatment. So chemotherapy will be required in addition to the radiation treatment as a concurrent modality. but the only it is not an core of the treatment. It will just benefit, it will just enhance the benefits of the radiation treatment. So it is a part of the treatment, but the radiation treatment would be the main chunk or main important modality for the treatment. I don't see any other questions over here. Technical team. I think the questions are over. So I would like to thank again everyone, and just to again to focus. So whenever any these kind of abnormal symptoms, you should seek your the medical attention of the medical practitioners, and so that we can cure it, the cervical cancer. Thank you.